Welcome to the Stroger Hospital Safety and Safe Work Practices Training Module for Environmental Services Workers. This training module will provide Stroger EVS employees an understanding of the broad range of safety topics, safety equipment, and safe work practices necessary to maintain a safe environment for employees, patients, and visitors of John H. Stroger Jr. Hospital. Specific topics we will cover in this training module will include personal protective equipment, also known as PPE, gloves for hand protection and infection control, hand washing, sharps protection, proper lifting techniques, eye protection, equipment safety, use of wet floor signs, bloodborne pathogens, also known as blood and bodily fluids cleaning chemicals, and safety data sheets. Through this video training, we hope that you feel prepared and equipped to safely handle the day-to-day responsibilities of an EVS employee. There are various types of PPE that EVS employees will be required to know and wear, and the PPE that you will use will depend upon the cleaning task you are performing and the area of Stroger Hospital that you will be working in. Let's talk about gloves first. Gloves protect the hands from contact with blood, bodily fluids, and they help reduce the transmission of germs, bacteria, and viruses. You are required to wear protective gloves in almost every cleaning task you will perform at Stroger Hospital. You are also required to thoroughly inspect protective gloves before each use to ensure that they are not torn, punctured, or made ineffective in any way. Any gloves with impaired protective ability should be discarded and replaced. To put gloves on, here's the procedure you must follow. First, thoroughly wash and dry your hands. For a detailed description of the required procedure for hand washing, see the Stroger training module and standard operating procedure number 3, hand washing. Next, remove the first glove from the dispenser box by the wrist end. Shake the glove open and gently insert the fingers of your other hand into the glove. Pull gently on the wrist end of the glove to ease your fingers and hand all the way into the glove. Now use your glove hand to pull another glove out of the dispenser box and repeat this same process to put the second glove on your other hand. Again, inspect both gloves to make sure there are not tears or punctures. If your gloves are in good condition, with no tears or punctures, then your hands are ready to proceed to the next step of your work assignment. Now let's talk about the correct procedure for removing gloves. You start with gloves on both hands. Choose whichever hand you want to remove first, and pinch that glove at the wrist and start to take that glove off by gently pulling it toward your fingertips. As you pull the glove, allow it to turn inside out. Once the glove is all the way off, leave it inside out and grasp it into a crumpled ball in the palm of your other hand that still has the glove on. Now to remove the second glove from your other hand, remember to try to avoid touching the outside surface of that glove with your bare, ungloved hand. Start by inserting your fingers into the glove at the wrist about 1 inch. Next, pull the glove away from the wrist and then down towards your fingertips, again allowing the glove to turn inside out. While doing this, keep your first glove crumpled into a ball in your gloved hand as you pull the glove off down toward your fingertips. It will wrap around the first glove you have crumpled into the palm of your hand and will get enclosed into the glove in a similar way like you fold clean socks, one into the other after laundering them. Once both gloves are removed, discard them and then thoroughly wash your hands. Other pieces of PPE consist of face masks, hairnets, and eye protection, also gowns, sometimes called jumpsuits or coveralls. Gowns, jumpsuits, or coveralls are used in areas where a higher level of infection control is needed and also for protecting patients and workers from bacteria or germs that might be present on your uniform or clothing. Examples of such areas include isolation rooms and operating rooms. Please make yourself aware of any gowning requirements and adhere to them in any area of your work assignment where this is required. Face masks, like gowns, provide an additional level of infection control and are needed in various areas of Stroger Hospital. Not only do face masks provide additional protection to our patients at Stroger, they also provide you, the EVS worker, with an added level of infection control protection. Isolation rooms, prenatal nurseries, and operating rooms are examples of areas where you will use a face mask or a respirator. Lastly, eye protection is used to protect the eyes from splashing, spraying, or aerosol dispersion. If you wear prescription glasses, be sure to use a pair of goggles or safety glasses that are made larger to fit over your prescription eyewear. Next, let's discuss proper hand washing. One of the best ways to reduce cross-contamination and maximize Stroger Hospital's efforts in infection control is frequent and thorough hand washing. Washing your hands is part of your Stroger's safety policy, and it is your responsibility to follow this policy to the letter. Always wash your hands. After cleaning a bathroom, before entering the patient room or procedure room, after completing cleaning in a patient room or procedure room, before and after removing protective gloves, before handling or eating food, after using the bathroom, after coughing, sneezing, or blowing your nose, before and after cleaning cuts or abrasions and changing bandages or soiled linen. For a more detailed description of the specific steps you must follow to properly and thoroughly wash your hands, please study Stroger Hospital's Standard Operating Procedures Number 3 and Training Module Number 3 entitled Hand Washing. Cuts from sharps injuries or from needle pokes are one of the most frequently occurring injuries to healthcare workers. All of us at Stroger Hospital must be very careful to avoid being cut by a hospital sharp tool or poked by a hospital needle. What are sharps? Sharps are syringe needles, IV needles, scalpels, and other tools used in healthcare that can cut your skin or poke through your skin and even your clothing, thereby causing injury. Why is a little cut from a scalpel or a poke from a needle a serious injury? Hospital sharps, such as needles or scalpels, may have germs, viruses, or bacteria present on the surface of the instrument. Therefore, if you are cut or poked by a sharps while working at Stroger Hospital, there is a much greater chance that you can contract a disease or illness from this injury than the chances of the same thing happening from poking yourself at home with a safety pin or cutting yourself at home with a kitchen knife. Stroger Hospital has put in place strict engineering controls to minimize the likelihood of you getting a sharps injury. For example, Stroger medical staff are all required to dispose of used needles and other disposable surgical tools in sealed sharps containers, which are mounted on walls in patient rooms, procedure rooms, and throughout Stroger Hospital. As part of your work duties as an EVS technician, you may be required to remove full sharps containers and replace them with empties. Sharps containers are specially sealed so that once needles and other sharps are disposed of inside, the sharps can never get out. Never, ever, under any circumstances, should you attempt to open a sharps container. If as part of your work duties, you are required to dispose of sharps containers, you dispose of the whole container, sealed and unopened. Non-disposable surgical tools, such as scalpels, are to be gathered by the medical staff, after the completion of an operation or a surgical procedure and taken to the appropriate location for sterilization. If you are assigned to service a Stroger operating room or surgical procedure room and you find surgical tools left out, do not touch them. Instead, inform your EVS supervisor so that a member of the Stroger medical staff can gather the items for proper sterilization. Medical waste such as towels or wipers with blood or bodily fluids are disposed of at Stroger Hospital into red medical waste liners marked with the medical waste biohazard symbol. If you find that medical waste has been disposed of in regular trash, report this to your supervisor for appropriate corrective action. Despite the engineering controls that Stroger Hospital has put in place to protect everyone from an accidental sharps injury, you must always be alert for sharps that have not been properly disposed of or improperly put away for sterilization. Always be on the lookout for sharps wherever you may be working. Also, always follow these basic precautions. When gathering any type of trash from any trash containers, never push down on the trash in order to try to compress the trash. Simply pull the liner out by the top ends of the liner bag. After you have pulled a trash bag from a trash container, hold the trash bag away from your body. Never let the bag touch or press up against your leg or any other part of your body, because a sharp object can poke through the bag and poke you. Never attempt to open a sharps container. If you find a sharps container open, report it to your supervisor. When gathering linens, either towels or bed sheets, first always inspect them for sharps that may have been left behind. Fold them into the center from the far corners into the middle. Never compress the linens with your hands or any other part of your body. Carry the linens from the corners you folded in, and do not let the linens press or bump against any part of your body. If you do receive a poke or a cut injury from a sharp or needle, report this to your supervisor immediately for appropriate medical treatment. Stroger EVS employees can avoid back injuries by properly lifting. Do not attempt to lift objects by yourself that weigh more than 35 pounds. Ask for help for lifting heavier objects. For objects that are 35 pounds or less, lift by pushing up with your legs. Do not lift by bending over at your back, then pulling the object up by straightening your back. This can cause back injuries, even when lifting objects that do not seem too heavy. As an EVS worker at Stroger Hospital, the protection of your eyes is of the utmost importance. Always use eye protection if you are working with cleaning chemicals or solutions, or if the area of the hospital you are assigned to clean specifically calls for the use of eye protection. At Stroger Hospital, 2 forms of eye protection are acceptable for your use: safety glasses with side shields or safety goggles. If you wear prescription glasses, there are specially designed safety glasses and goggles available for you that fit over your prescription glasses and frames. Be sure to utilize these specifically sized goggles if you are a wearer of prescription glasses. As a Stroger Hospital Environmental Services worker, you must follow basic safety procedures for the use of electrical-powered cleaning equipment, such as vacuum cleaners and floor buffers. Always inspect the equipment for loose wires, connections, or parts. Check carefully the electrical cords and the electrical plugs. If the cord is cut or worn through, do not use that piece of equipment. Report the bad cord to your supervisor. Also, all equipment should have a 3-prong plug, where the 3rd prong is for the electrical grounding. If the 3rd prong or one of the other prongs is missing from the plug, do not use that piece of equipment. Report the condition of the plug to your supervisor. At Stroger Hospital, the EVS department uses a color coding system for our microfiber wiping cloths. Blue wipers are for general cleaning, and orange wipers are for bathroom cleaning. Always follow this color coding protocol, and always use the right colored wiper for the job. This helps prevent cross-contamination of germs, bacteria, and viruses. Also, keep your color-coded wipers separated in the charging bucket and never overfill the bucket. Put in just enough cleaning solution to thoroughly soak the wipers, but not so much that the solution level is higher than the tops of the wiper cloths. Finally, once you use a wiper to perform a cleaning task, never put the wiper back in the charging bucket. Place used wipers in the soiled linens liner, and when you perform your next cleaning task, start with a clean, fresh wiper from a charging bucket. When you are positioning your cart before cleaning a patient room or other area, do not bring your cart into the room. Instead, position your cart just outside of the room door, to the side of the door opening. Never block the room door opening with your cart. Always use wet floor signs to alert patients, medical staff, and guests that cleaning is in progress. Position one of the wet floor signs outside of the room near the door. Position the second sign inside of the room. If you are mopping, stripping, waxing, or scrubbing a lobby, hallway, or other public areas of Stroger Hospital, position one wet floor sign about 20 feet in front of where you are working, and one about 20 feet behind you. At any time during your cleaning shift, you may encounter situations where you have to clean up spills of blood or bodily fluids. Always follow the Stroger Hospital protocol for blood-borne pathogens cleaning, as found in the Stroger Standard Operating Procedure and Training Module number 24. A summary of the important points in this protocol is: use full personal protective equipment including gloves, coverall, jumpsuit, foot covers, face mask, hair cover, and eye protection. Spread the product Super Absorball on and around the fluid and wait for the fluid to soak into the Super Absorball granules. Sweep up the granules once full absorption has occurred. Dispose of the granules and any wiping cloths or disposable wipers you may have used as medical waste using a red medical waste liner. Dispose of any mop heads and your entire PPE, except for your safety glasses, into the medical waste red bag. Thoroughly wash your hands upon completion of the work. Generally, all of the cleaning chemicals and solutions that you will be using at Stroger Hospital are safe and do not pose any safety risk for you, for patients, for visitors, and for the medical staff at Stroger. However, you must exercise common sense and good judgment when you use these chemicals. For example, you should be well aware that any cleaning solutions are not intended to be ingested into the mouth, the nose, or the eyes. Also, while most individuals will not have any skin problems due to accidental exposure to the cleaning solutions on their skin, there may be some people who have highly sensitive skin or who might be allergic to one or more ingredients in the cleaning solutions. For these reasons, always observe these precautions. Never let cleaning chemicals enter your mouth, ears, eyes, or nose. If by some chance you do ingest cleaning chemicals into one of these areas of your body, report to your supervisor immediately for treatment. If you have any questions about treatment for accidentally ingesting or being exposed to the cleaning chemicals, please refer to the Stroger Safety Data Sheets. or the SDS for the cleaning chemicals. Always wear your gloves when performing cleaning work. Always wear your face mask and eye protection. Minimize the spraying of cleaning chemicals. Instead, apply cleaning solution to the surface to be cleaned in a liquid application, not a spray application. That concludes Stroger Hospital's EVS Training Module Number 2, Safety and Safe Work Procedures for EVS Employees. We hope you have enjoyed this training module and have found it to be highly informative. If you have any questions, or if you ever have any concerns about safety, please do not hesitate to ask your supervisor. If you experience any sort of injury at work, please report it to your supervisor immediately. Thank you.